Okay, so knee replacement recovery is not always linear. People expect the recovery to be that way on the graph. It never is. It's more like that, okay? Now, very importantly, one of the reasons why I love to get patients up early, so therefore operating early, relatively early in the morning, is that they will have a good day on what we call day zero, the day of the operation. They're usually, all the medications on board, the spinal, the painkillers are all working, and therefore they're relatively comfortable to get up and walk on that day of operation. Interestingly, the day after that, that is when there is usually a dip. Why? Because the medications may have worn off. There may be some side effects in that medications, particularly like a sort of hangover feeling where you're feeling tired. Maybe they haven't had a good night's sleep. Maybe there's just different food in the hospital. Maybe there's different noises in the hospital they're just not used to. So as a result, sometimes patients dip on the day one, i.e. the day after the operation. And I warn patients of that. Sometimes they come in, on that day one and they're completely fresh and they've had a good night. But it is often the case they might dip on that day one and then they kind of recover in that kind of fashion. But on the whole, the recovery does get there, but it's not a linear process.